The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Welcome to the ASCO in Action podcast. This is ASCO's monthly podcast series where we aim to explore the policy and practice issues that can impact oncologists, the entire cancer care delivery team, and most importantly, individuals who we take care of, that is, people with cancer. My name is Clifford Hudis, and I'm the CEO of ASCO, as well as the host of this new ASCO in Action podcast series. For today's podcast, I am really excited to have as my guest Dr. Robin Zahn, who has served as chair of ASCO's Government Relations Committee and was recently recognized just in the past year as ASCO's Advocate of the Year, and you're about to see why. Dr. Zahn is a medical oncologist at Michiana Hematology Oncology in Indiana and a real champion for high-quality oncology care. Tireless, you might say. So our conversation today is going to focus on congressional advocacy and the role it plays in shaping cancer-related policies. We're also going to discuss the outlook for cancer-related policies in Congress, specifically in 2018, and we'll explore some of the ways that the oncology community can influence federal health policy, especially those ways that might impact our profession and, again, and most importantly, the patients we serve. With that, Dr. Zahn, I welcome you and I thank you for joining me today.
Thank you, Clef. It's a real pleasure joining you today.
So I want to turn my attention to the big question first, and this is one which in the current political climate I am sure has some members shrugging their shoulders. Why does advocacy at the congressional level actually matter? That is, why should oncologists and others in our already burdened, busy community care about what's happening in Congress? Why should they try to do anything about it? Does it really make a difference for providers and ultimately for our patients?
So to answer your last question first, I really do believe that our involvement absolutely makes a difference, not just for providers, but most importantly for our patients. And the reason why is that Congress really impacts our policies and our ability to effectively care for patients on a daily basis. They play an important role actually in all aspects of cancer care, whether you're conducting research or whether you're buried by prior authorizations or you're dealing with underwater drugs in some cases, or if you're just simply worried about your patient being able to afford their drugs, you really need to be paying attention to what's happening in Washington. In fact, that's why ASCO is so vocal on Capitol Hill, and more importantly, why it's so important that the entire oncology community take action on policies that are important to them and to their patients. And in fact, the most effective thing that we can do to really try to influence our members of Congress is to call or visit with them. They really take seriously when providers who are actually caring for their constituents in their community come and talk to them and help them understand what the needs are and what the challenges are in delivering good care to their constituents.
Yeah, so I have to say one of the reasons, one of the ways in which I was drawn into deeper involvement with ASCO, even when I was a volunteer, was because of my activity in the political domain in general and specifically in the GRC. I think we all go through a little bit of a life cycle education where you develop some degree of cynicism probably about the political process. Yet what I saw is something along the lines of what you say, which is the rewards may not be immediate, but the return on investment actually is there. And one of the important ways that anybody in Congress can be informed is by learning from the experts, and that is in this domain, ASCO. So I wonder whether you could give some examples, something that might illustrate to the members how this really can work.
So I think you make a great point that when we're dealing with advocacy and policy work, that there are some situations where you might have wins in the short term. But really, the way we're going to be most effective is if we develop policy priorities and we advocate a consistent message over a period of time. And so to give you an example on two issues that we're dealing with, one in which we had considerable success and the other in which we're still actively fighting to to bring home the point of the need to continue to advocate for policy. So let's talk about the first one, and that's a success story. So as you know, the National Institutes of Health, or NIH, really relies a lot on federal support for clinical research. In fact, it's integral, as we all know, that clinical research be effective and successful to be able to advance oncology care. But it took us a lot of years to try to convince the government to fund the NIH above and beyond flat funding. What in fact was happening is that the NIH was getting funding every year, but there was never an increase. So when you consider inflation, really what we were seeing is that there was a cut to the NIH. So there was a lot of hard work by a lot of groups of people, by patient advocates, by advocates from the entire biomedical community, as a matter of fact, to be able to drum up some strong bipartisan support for the significant and sustained increases to NIH. So finally, we were successful. We as a community group were successful in being able to get increases to the NIH. And as of this recording, Congress is still working through the budget for 2018. But what we did see in the prior year, 2017, was a sizable increase in funding. And actually, we're getting indications that if Congress can work through all these other unrelated issues, that the NIH will receive another significant increase in its budget. Keeping in mind that it took several years for this to actually happen. We identified the problem, we set a policy priority, then we advocated a consistent message in line with our sister societies to make this happen. The second issue I'm going to raise deals with the CMS, the Center for Medicare and Medicaid Services, and it has to do with a rule that would unfairly penalize the oncologists under the MACRA law. Now, as we all know, the MACRA law was passed in order to be able to promote quality and value in the healthcare. And along with that came a new scoring system that would in fact impact physician reimbursement. The scoring system is called MIPS. And basically what the MIPS does is that it indicates to the physician practice whether they're going to get a bonus or a penalty, depending on the quality of care that they're providing and the associated cost to do so. Recently, however, CMS has announced a new rule that would also apply these payment adjustments to Part B drugs that are administered in the physician's offices. Now, previously, MIPS was to be applied to office visits and the admin codes for the drugs, not the drugs themselves. So this is, in fact, a major departure from what Congress had intended when they passed the law, because it basically either amplifies the bonus or penalty, which is unfair. And it's not only in oncology. It's in other specialties as well that administer high-cost drugs, such as, for example, rheumatology and ophthalmology. So we've been to CMS, and we've had members of Congress ask CMS not to do this. Well, CMS's response is that because it's a statute, that the only way to change this is through legislative intervention. So we identified a problem. We realized that it was a major departure. We went to the folks in whom the ruling was made that was going to affect the oncologists, and were told, you need to deal with this legislatively. So to answer this, ASCO has been working with other specialties to lobby Congress for this change, and we've done that through a number of mechanisms. That includes Hill meetings, such as the ASCO Hill Day that we had this past September, joint meetings, joint letters, news releases, and much more. And in fact, we've been encouraging our ASCO members to contact their members of Congress directly through the ACT network. So we're continuing to work on this very, very important issue, and we're cautiously optimistic that this may be corrected. So this is an example where a very technical interpretation can have an enormous impact on our patients. So ASCO has been paying attention to this and again has been working diligently to try to resolve this in a way in which it's fair to our oncology providers and ultimately their patients.
Yes, and this comes back to the point that ultimately in Congress there is a great deal of respect for domain expertise and a thirst for accurate and actionable, useful knowledge. Your story about the NIH funding reminds me that for many years we felt downtrodden. We would go year after year. We would ask the same of Congress, which was in those days about a $2 billion annual increase in the NIH budget, and we did not get it. And this went on. And then, I guess, 3 years ago or so, a switch seemed to be flipped. And as you point out, the $2 billion increases started to come year over year. And what was most exciting is there was a bipartisan claim of ownership for that support. So nothing makes me happier than to see the Democratic and Republican friends in Congress each claiming that they are responsible for increasing the NIH budget. Frankly, I don't care who gets the credit. I'm delighted that it paid off. But it makes a point something that's somewhat frustrating, I think, for people who don't do this all the time is that you have to stay at it. You have to accept it on a daily basis. You might not see that return, and yet in the long run, it may accrue. So patience is a virtue, right?
Absolutely. And you're exactly right about that point. It does require persistence, and you need to remain focused and not become unnerved. Because eventually, as that success story shows, working together and collaboratively, we actually have been able to make a change.
So one thing that I think many members will ask about, and we've seen a little more of this of late, is the local aspect of political advocacy and policy activity. And in this case, we mean at the state level. Do you think that our members should be paying the same kind of attention at the state level as we are discussing here at the federal level?
Oh, absolutely. And I couldn't agree with that more. In fact, not only should our members be paying attention to federal level activities, but also the state levels, as you mentioned, because states, as you know, are becoming very critically important in terms of setting policies that can impact cancer care locally. In fact, ASCO has been very active at the state level through direct contact with the state legislators and governor's offices, state insurance commissioners and Medicaid offices. And in fact, ASCO does provide assistance to our members and the state affiliates with toolkits, with information on very important legislation that their state may be considering, as well as other guidance. There are many issues that may be, in fact, at the forefront of the state legislative discussion, which is actually this time of the year for most of the states. But from an ASCO perspective, we're paying particular attention to the clinical pathways, opioid education requirements for providers, and tobacco policies.
Yeah, those are all, I think, big issues, and I see that they will be dealt with at the state level in some cases, even before they're dealt with at the federal level. So I think that this is important for savvy listeners to think about engaging. But turning back to the federal level and focusing on the 2018 Congress, what do you think that ASCO should be looking at in 2018? What is the most pressing area of concern for us in terms of legislation impacting cancer research or care delivery?
Well, as everybody in the audience understands, Congress has a lot to tackle this year, and the administration continues to attempt sweeping changes to the nation's healthcare system through regulation. So there's a few high-profile issues that may in fact be on the agenda, and this includes addressing the very high cost of drugs, including potential activity on the 340B program and Part B drugs, and the continued changes to the Affordable Care Act. Now that they've repealed the individual mandate, changes will likely be through administrative action. But they also need to fund the government, and hopefully with increases to the NIH, as we just discussed. But in addition, ASCO will be trying to get Congress and the CMS to focus on other issues. For example, coverage of clinical trials, as well as the reimbursement issue that I just mentioned earlier.
And I know it's always hard to make predictions, especially about the future, but with the November midterm elections now coming into focus and really, I think, going to be a source of lots of speculation and discussion, do you see a way that the midterm elections could affect the congressional agenda? What do you think we have to be on guard for?
Well, there will definitely be an effect on midterm elections with regards to federal activity. In any election year, members of Congress tend to actually spend more days at home in their own districts instead of taking votes or holding hearings in D.C. So with less time in Washington, there's actually fewer pieces of legislation that do tend to move forward. And the bills that do advance, they tend to be much less controversial for a number of reasons. This is particularly true for the latter half of the year when the midterm elections are really on everyone's mind. So that means that it's critically important for us to be vocal now about the issues that are important to the cancer community. But there's also opportunity in this, and that is because the lawmakers will be back home, they're often much more comfortable and feel less rushed. And this is actually the opportunity for members to reach out and help build cancer policy relationships and champions on Capitol Hill to further our activity and our policy recommendations at the federal level.
So obviously you have to be a little bit of I think a political or policy wonk to engage in a continuous basis on all of this. And that often exposes you, I think, to acronyms that are outside of our field, like the HELP Committee and others. So I wonder for our listeners if you could highlight the committees and legislators that have a really good understanding of cancer policy priorities and what you look for when you're following their work?
So there are actually just a few committees in Congress that have jurisdiction over our issues, the issues that are meaningful to us. And what that means is that the lawmakers on those committees often have more expertise in the issues that we care about most. So there's actually 6 committees, and those include the House Ways and Means Committee, the House Energy and Commerce Committee, the Senate Finance Committee, and the Senate Health Committee, as well as the Appropriations Committee in both chambers. But that said, as we are focusing in advocating for policy for our members and our patients, we certainly work very closely with those committees. But remember, every member of Congress is influenced. So it's absolutely critical that we engage with every single representative and senator, because of course we're going to be most successful when we have a large number of lawmakers working on our behalf.
So one of the challenges I think a professional society faces, and we've grappled with this, is the balancing act between the varied points of view that our individual members may hold and the need for us to take a stand and to actually commit to a specific position on legislation. Can you explain to our members why at times we have to take a very specific stand?
So as an oncology community, we, our members of ASCO, provide a very unique perspective on what is required to not only conduct cancer research, but to deliver high-quality care. We need to keep in mind that the members of Congress are really just as busy as oncologists. So they rely on us as go-to resources to share our expertise so that they and their staff can better understand potential policy impact on our patients, our practices, and the communities.
So the point being that by having individual members of ASCO representing the whole show up in offices, we're able to make personal and human the positions that we take, and that always, I think, carries more weight. Is that a fair assessment?
Absolutely. I think that when our policymakers, our members of Congress and staff, see somebody that comes in from ASCO, they realize that, that we're representing our patients, of course, and what our member needs are, and that we have an expertise, in cancer. And so they do look to us for that expertise.
So let me follow up on that a little bit, and maybe we can get even a little more precise. And can you talk about some of the very specific ways that ASCO advocates on its policy priorities?
Right. Well, we actually have a number of mechanisms that we can use for advocating for policy priorities, and that would include meetings with congressional staff as well as members of Congress. We also write a number of letters and comments to congressional leadership and the administration, and then publicly comment in written media statements and social media. We have the Advocacy Hill Days in D.C. that I mentioned earlier, as well as the in-district meetings at home. And very importantly, we activate ASCO members via the legislative action alerts on the ACT network.
And so that means that we basically communicate with them and ask them to write or in other ways contact their local representatives to help demonstrate the broad support for our positions, right?
That's correct. In fact, the ACT network is so nice because the letters are actually pre-written. And you can certainly customize those letters at will, and then very easily with just some clicks, you can send off those letters to your local representatives in less than 3 minutes' time.
Yeah, that's great. So I mentioned when we were introducing you that you head up ASCO's Government Relations Committee. For the uninitiated, can you describe briefly what that committee actually does?
Well, certainly. Every 2 years, the Government Relations Committee establishes ASCO's policy priorities, which are then reviewed and approved by the Board of Directors. The committee, however, very carefully examines both urgent or emerging policy issues within the congressional and administrative landscape, and then also assesses feedback that's raised by other committee and ASCO members.
And where do the ideas for policy priorities actually come from? How do you get onto the docket?
Well, great. That's a great question because the priorities don't just come from the GRC as one might think. We actually very carefully consider other ASCO committees' concerns and individual members' concerns as well. It's really important for us to hear what's happening in practices across the country, such as through our state and regional affiliates. And in fact, members of Congress have sometimes suggested legislation to us. And sometimes these ideas come from places you wouldn't expect. And there's this great example. During a meeting with a congressional staffer about unfair reimbursement under Medicare, The staff member responded and told us that if we didn't like how we were being reimbursed, then maybe we should come up with our own plan. So that, in fact, Cliff, was the spark that eventually led to the creation of the PCOT model, which is also known as the Patient-Centered Oncology Model, which is ASCO's answer to a proposed alternative payment model specific for oncology.
One of the things that we pride ourselves on and we strive for is what we've termed evidence-based advocacy. That raises the question, can you describe how the GRC actually evaluates legislation? How do we make sure that we meet and exceed even that ideal of always advocating on the basis of evidence?
So basically, when we're evaluating legislation, there's two questions that we want to ask. And the first is will this promote or hinder high-quality cancer care? And second, is this good or bad for the patients we treat? But we also take the pulse of our membership to try to determine, well, how is the legislation going to actually impact them and their patients? And whether or not taking a position on this bill will help us achieve one of our policy priorities. But we also work with our sister societies and we have other stakeholders that we consider because we want to make sure that if possible, we have a unified voice whenever we can. So we weigh all those things before we take a position. So let me give you an example. We knew healthcare reform was certainly going to be a top priority for the new Congress and the administration this past year. So we wanted to be certain that policymakers understood how any legislation they considered would affect patients with cancer. So we actually formed a list of principles for patient-centered healthcare reform. Then we used those principles to help evaluate both House and Senate legislative proposals to determine if they would receive ASCO support.
Yeah, that's really important, and I commend the committee for that because in those contentious discussions, again, it was, I think, very important and useful for us to be able to turn to a list of predetermined policy goals and initiatives, that's our evidence, and actually stay out of the politicized debate about reform. That is to say, we were doing it for deeper reasons than left-right, and I think that that's something that takes a lot of continued effort and focus on everybody's part. Now, I mentioned earlier that back in September, you were named ASCO's Advocate of the Year. And look, that's quite a feat for anybody, especially when you consider the size of ASCO with well over 40,000 members right now. I briefly mentioned what led me to deeper involvement with ASCO and advocacy in the past, and I'm curious what happened with you. What made you get so involved in advocacy? What are some of the things you've learned along the way in terms of how to be an effective advocate?
Well, thank you for asking. And first, I just want to thank ASCO for this incredibly humbling award, especially since 20 years ago, when I joined my practice, I never envisioned that I would one day have the privilege to be involved in policy at this stage in my career. But what I've appreciated over the past 2 decades is that there's sweeping legislative and reimbursement changes that were and are continuing to affect our ability to advance cancer care in our patients. That said, I realize that as a provider that we need to come from behind our stethoscopes and research activities and step up as a patient advocate in an effort to be part of the solution. So through all of this experience and training, there are these top 4 pearls that I'll share with you in terms of advocating for policy. The first is when speaking to congressional staff or members, as a patient advocate, carry a real patient story with you. Putting the face of a constituent to an issue adds a palpable accountability on the part of the legislator. Second, conduct in-district meetings and please invite them to visit your practice where they can meet staff, other providers, and patients. Remember, it's their community, so they should have an interest on the local impact of their decisions. Third, be willing to offer yourself as a go-to resource for them at home as well as on Capitol Hill, especially for not only the federal but the state legislators, especially in these times as we know of increasing state influences on local care. And finally, use the ACT network. As it turns out, and I mentioned earlier, Cliff, it only takes 3 minutes for you to send a pre-written letter, and it really, really makes a difference.
Yeah, I can attest to that. Every time I do it, a couple of weeks later, I get a probably similarly personalized note back from my senator or representative. So it's interesting to slowly build up a dialogue through that. But that's my story. How can the average individual ASCO member become an advocate? What do you recommend they do?
Well, first of all, I would encourage all of our ASCO members to become involved in advocacy. It can be as simple as sending a message to your representative with either the federal or the state ACT network. And it's quite easy to participate. You sign up, you get an email letting you know that there are letters ready for review. You review the letters, and you click send, and it takes less than 3 minutes. Beyond that, I would encourage our members to follow the ASCO in action to try to stay current. But I also would encourage our members to set up meetings with both federal and state representatives as well as the governor's office. And for those in the audience who are social media inclined, you can certainly follow many of your lawmakers through Twitter. Finally, I would especially encourage our members to check in with your state affiliates, as well as with the ASCO staff at grassroots@asco.org for further information regarding activities you may be interested in.
Well, I want to, first of all, thank you again, Dr. Zahn, for joining me and our listeners today for this ASCO in Action podcast and for sharing your great insights into the congressional year ahead with all of us. Thanks for doing that.
Thank you so much for having me join you. And again, it's just been a pleasure to work with the committee. And I just want to say how impressed I am by both the ASCO leadership, you, Dr. Hudis, as well as the staff, in representing the society, its members, and our patients' needs. Thank you.
Well, I think that the most important thing here that is this wonderful demonstration of the rewards and impact of active advocacy on cancer-related policy issues. You've heard a few of those described by Dr. Zahn, and there are many, many other opportunities for all of us collectively to make a difference. If you would like to learn more about ASCO's advocacy work and the activities that are happening here in Washington and indeed around the country, I encourage you, as Robin suggested, to visit asco.org/ASCO in Action. The ASCO in Action is written as 3 words with dashes in between them. And that's a nice starting point for your exploration of this issue if you're willing to spend some time. We also encourage everybody to get more involved in ASCO advocacy efforts by visiting asco.org/ACT network. ACT network is written as 1 word. That's where you can learn more about legislation, and you can send messages directly to members of Congress, as we've described. With that, until next time, I want to thank everybody for listening to this ASCO in Action podcast, and once again, thank Dr. Robin Zahn for joining us.